Being born too early or preterm affects almost 1 in 10 babies in Aotearoa and is a leading cause of death and disability. New Zealand European families experience significant advantage with lower rates of preterm birth and greater survival following preterm birth than Māori, Pacific and Indian whānau. Current clinical practice guidelines vary greatly around the country and are not fit for all, which may significantly contribute to these differences in outcomes. The current situation is unjust and unfair, and a nationwide, culturally appropriate guideline is required, with a focus on equity for all whānau. So, let's meet the 5 babies of my PhD. The first is Eva, a systematic search and evaluation of guidelines. Which ones are in use by local health services, and are they any good? In this study, I identified 235 guidelines, but less than a third met the criteria for high quality. 14 of our 20 hospital regions provided information on their guideline use, and alarmingly, we found that the guidelines being used were of much lower quality than the guidelines available for use, and only a tiny number reported Māori involvement or use of an equity tool in their development. The guidelines we identified as high quality are being used to inform a new national best practice guide. Next, Courtney, a study to determine the core outcomes that should be collected to assess the impact of our best practice guide. I systematically gathered information on what other research groups have determined to be the most important outcomes for maternity and newborn research, then developed a Delphi survey to identify the most important outcomes for preterm birth care. We had an emphasis on involvement from consumers, Māori, Pacific peoples and Indian. 95 individuals were involved, and we have determined the 15 most important outcomes for preterm birth care and research. Next, Darcy, a review of data sets to see if any of these outcome data are already being collected in our health system, and if so, by who and how accurate is it? Now, we all know even the best guideline is useless if nobody uses it. So my next study, STAN, is a systematic review looking at tools for guideline implementation. I'm analysing 20 studies to determine which tools best help guidelines to be implemented and whether any of these tools have been developed with cultural considerations. Lastly, Cooper, a nationwide community of practice network to educate and support clinicians to improve their knowledge on the prevention of preterm birth so that all New Zealand babies have the best chance of a full-term pregnancy and a healthy start to life. Thank you.